Welcome to miniEM. In this video, I'm going to walk you through flexible nasopharyngoscopy. This is the way that you can look at the upper airway at the bedside. So if a patient is presenting with stridor, hoarseness, dysphagia, or a suspected foreign body, you can actually put this tiny camera down their nose and you can look at their larynx and their pharynx. Okay, so the first step is to sit your patient upright in the sniffing position. It's important to have something behind their head because they're going to naturally pull away from you. You can let your patient decide which one of their nostrils feels more patent at the moment. Start by spraying Afrin, also called oxymetazoline, into the chosen nair to decongest them. After the Afrin, have them snort this lidocaine cream. This does not taste or feel good. Do it as many times as you can to get as much medication in there. And wait at least 5 minutes. If you rush it, you're going to be fighting their gag reflex the entire time. Next is an optional step where you can take 4% liquid lidocaine, draw it up into a magic atomizer, and let it drip down into the back of the throat. Oftentimes, if you use enough of the lidocaine cream and you wait for enough time, you really don't end up needing the lidocaine liquid. Okay, now it's time to plug the scope into your display. If you're feeling nice, lubricate the distal end for your patient, but make sure that you keep the lens itself clean. Take note of how he's holding the scope. He's holding the base of it with his right hand, which is his dominant hand, and then his left hand is stabilizing towards the distal end near the camera. The purple joystick is on the bottom of the white base, and if you pull it towards the patient, the lens will look up, and if you point it away from the patient towards you, the lens will look down. If you turn your hand clockwise or counterclockwise, you'll rotate left and right. Anchor your hand on the patient's nose so that if they flinch, the scope flinches with them and it doesn't go into them. Insert the scope along the floor of the nose, perpendicular to the face. This is exactly like placing an NG tube. So you should imagine inserting this and aiming towards the tragus. Do not angle up into the turbinates. This is just a warning. Do not do this on anybody that has mid-face trauma. You might end up in the brain. Advance slowly into the nasopharynx and then direct the tip downward to look at the soft palate and the uvula. Continue advancing past the base of the tongue, and then you will see the epiglottis. Center those vocal cords on the monitor. This is where you get to do your evaluation. So you can evaluate for foreign bodies in the larynx, swelling of the epiglottis or the vocal cords, masses, or even soot. Inspect the puriform sinuses. This is where masses or foreign bodies end up. If you want to lift the epiglottis out of your line of sight and get a direct view of the vocal cords, E is the magic word. And then withdraw slowly when you're done. All right, that's how you do flexible nasopharyngoscopy. Check out the rest of our miniEM library for some more procedural education.